What is a sweat test for cystic fibrosis in infants? Imagine a simple test that can help doctors find out if a baby has cystic fibrosis, a condition that affects the lungs and digestion. That test is called a sweat test. It's the most reliable way to confirm or rule out cystic fibrosis in infants. The test measures the amount of chloride, which is part of salt, in the baby's sweat. Babies with cystic fibrosis usually have much higher levels of chloride in their sweat, 2 to 5 times more than normal. The test is often done if a newborn screening shows a positive result for cystic fibrosis, if there's a family history of the disease, or if the baby shows signs like poor growth, frequent lung infections, or digestive issues. It can be performed as early as 2 days after birth, but sometimes it needs to be repeated. This is because newborns sometimes don't produce enough sweat for an accurate reading, especially in the first days of life. During the test, a small patch of skin on the baby's arm or leg is prepared. A tiny amount of a chemical called pilocarpine is applied, which is combined with a gentle electrical current. This stimulates the sweat glands to produce sweat. The sweat is then collected on a special filter paper, gauze, or in a small plastic coil over about 30 minutes. The whole process takes around an hour. It's completely painless and does not involve needles. The baby might feel a warm or tingling sensation during the stimulation, but there's no discomfort. The collected sweat is sent to a laboratory where technicians measure the chloride level. If the chloride is high, it suggests cystic fibrosis. If it's normal, cystic fibrosis is less likely, but sometimes further testing is needed. The test must be done at a care center that follows strict guidelines and is accredited by the Cystic Fibrosis Foundation to ensure accurate results. If the first test doesn't give a clear answer because not enough sweat was produced, it can be repeated after a short period. Early diagnosis through this test is very important because it allows healthcare providers to start treatment sooner. Managing cystic fibrosis early can improve a child's health and quality of life as they grow. In summary, the sweat test is a safe, painless, and essential tool for detecting cystic fibrosis in infants. It helps doctors make accurate diagnoses after a positive screening or when symptoms are present. If you have concerns about your child's health, always consult a healthcare professional for personalized advice.